Hello, everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. I'm going to continue my series where I speak about low back pain and a specific activity or a specific sport that low back pain is common to. What I'm going to speak about today is golf. The great game of golf is played by millions worldwide. And the great game of golf also is a contributing factor to low back pain. Low back pain is common among golfers. Mechanical low back pain and sacroiliac joint dysfunction are common problems among golfers. Prevalence of low back injuries is estimated between 15 to 35% in amateur golfers and up to 55% in professional golfers. Low back pain is associated with significant time loss from golf competition and practice. Recurrent injuries are frequently seen in golfers. Modern swing technique uses increased separation between the upper trunk / shoulders and the pelvis at the peak backswing and during the downswing. The separation angle between the upper trunk and the pelvis is called the X factor. Increasing X factor may enhance angular velocity of the trunk towards the lead nondominant side and therefore increases velocity of the clubhead, but it requires adequate spinal mobility. The modern golf swing is associated with increased lateral flexion on the trail side. This peaks at impact and during the early follow-through. An additional component of the modern swing that has been proposed to contribute to low back pain is trunk hyperextension or reverse C position. This occurs during follow-through. These factors may result in greater compressive and shearing forces to the lumbar spine. The lumbar spine is the medical name for the low back. Most low back pain among golfers occurs during the follow-through phase, which contributes to increased pressure on the spine. Most golfers report back pain developing over time rather than one traumatic incident. Common low back pain includes muscle strains, spondylosis, vertebral stress fractures, osteoporosis, facet joint irritation, and disc herniations. Among golfers, the low back is most vulnerable to injuries because it undergoes strenuous movement and muscular activity while swinging the golf club. Also, golfers who carry their own bags have twice the incidence of back injuries compared to those who do not carry their bags. The golf swing is a repetitive asymmetrical motion that is associated with high segmental angular velocities and substantial compressive, torsional, and shear loading of the spine. Let me repeat that. The golf swing is a repetitive asymmetrical motion that is associated with high segmental angular velocities and substantial compressive, torsional, and shear loading of the spine. So when you are golfing, it is repetitive. You are doing the same motion over and over and over again. And that motion is asymmetrical. So you are constantly using the muscles on one side differently than the muscles on the other side. And then there is a large amount of torque and compression and shear going on in the spine. If a golfer is right-handed, the left external oblique muscle, the lumbar paraspinal muscles, and the rectus abdominis muscles are the muscles that initiate takeaway. At the top of the backswing, the right-sided external obliques, the paraspinal muscles, and the abdominal muscles initiate the highest load of swing and are dominant throughout impact. The right lumbar region in right-handed golfers is the most commonly injured area. Injury prevention is less expensive, easier, and faster than injury rehabilitation. So some general guidelines to prevent low back pain while golfing. Use proper fitted clubs. Use a long putter because it may decrease stress and strain on the lumbar spine. If you are carrying your golf bag, use a dual strap bag because this allows these clubs to be distributed evenly across both shoulders. Increased body weight is a significant risk factor for low back pain among golfers. Therefore, weight loss and nutritional counseling need to be part of any golf injury prevention program. Improved swing technique and physical fitness seem to reduce injury frequency. Movement patterns, muscle imbalances, and type of swing utilized all have a direct effect on forces applied to the spine during the golf swing and need to be assessed to prevent or rehabilitate low back injuries. It is extremely difficult to isolate one muscle as most important during a golf swing. Core stability is a fluid, continuous motion among many parts. If one part is not functioning properly, the entire motion is compromised biomechanically and may lead to excessive stress on other body parts. Therefore, the entire core must be trained and there must be core stability to help to prevent low back injuries and help to rehabilitate low back injuries. Core stability training is an important part of any prevention and rehabilitation program for a golfer. To initiate core control correctly, diaphragmatic breathing, pelvic tilting, and pelvic floor exercises are recommended to activate and train the core muscles. Start at your current health, fitness, and strength level. Activation of the diaphragm, pelvic floor, and abdominal muscles is essential to trunk stabilization during respiration and postural activity and should be incorporated into a golfer's prevention and rehabilitation program. Training the transverse abdominis, the multifidi, and the hip abductor muscles is a necessity in any golf prevention and rehabilitation injury program. In review, when we speak about preventing and rehabilitating low back pain from golf, you want to make sure that you do core strengthening and core stability exercises. Now, there is not one muscle that is more important than all of the other muscles when training your core. But you want to think about focusing on several different muscles. First of all, the diaphragm. The diaphragm is the primary breathing muscle. You can perform normal breathing, which is also known as diaphragmatic breathing. I have a video where I explain how to do that, and I will put a link to that in the description box below. It is called normal breathing or diaphragmatic breathing. This is going to help you to check to see if you are using your diaphragm when you are breathing, and if you are not, how you can train yourself to use your diaphragm while breathing. Also, you want to focus on strengthening the transverse abdominis muscle. The transverse abdominis muscle is the deepest of the core muscles. It acts as an anatomical support and weight belt to stabilize the spine. The transverse abdominis muscle can be strengthened with the abdominal hollowing, which is also known as stomach vacuums, and the abdominal drawing in maneuver. Those two fundamental core exercises will help you a great deal in strengthening the transverse abdominis muscle. And also you want to strengthen the lumbar multifidi muscles. These are the small muscles in the deeper part of the spine that connect one vertebrae to the next. When contracted bilaterally, the multifidi muscles extend the spine. You could strengthen the multifidi muscles by performing football lumbar spine extensions. Thank you, everybody, for watching today's episode of Dr. Ozello's Sports Medicine Report, where I spoke about how to prevent and rehabilitate low back pain from golf. Do yourself a big favor. If you have low back pain, please see a medical professional. It could be a doctor of chiropractic like myself, or it could be another type of medical professional. But you want to make sure that you get an evaluation, a diagnosis, and a treatment plan. Please do not self-diagnose yourself. Also, never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, stop immediately and find a viable substitute. Always work through a symptom-free range of motion when you are performing an exercise. Even if that range of motion is very small, you still want to work through a symptom-free range of motion. Thank you for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also find my blog. Again, my website is championshipchiropractic.com. My blog contains articles on sports medicine, spine health, fitness, exercise, and nutrition. Please feel free to like, this video. If you have suggestions, feedback, or questions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Always remember to train hard, but train smart. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your